Hello everyone, myself Omdesh Pandey, and on behalf of my team Coding Predators, I would like to welcome all of you to our presentation for our project named Safe Pulse. It is based on the theme EdTech, Biotech and Health Tech. Now let's understand what is the problem statement. Now to understand the problem statement, let's get a quick understanding about the geography of India. Geography of India is mainly divided into two parts, the urban areas and the rural areas. And in the rural areas often fall the villages, and these villages are the ones which are not much developed, and these villages often share a common water source, like for all the people living inside a village, they will have the same water source which is being used for cloth washing, then drinking, and as well as for bathing, and also all the tasks which requires the usage of water. And now what happens is that as there is a one single common source used by all the villagers for doing the water regarding tasks, if sometimes the water gets dirty, or if there is a water logging take place in that water source, if it is there for a long period of time, then due to which the people living there consuming that water source for cloth washing or for drinking or for any other task, then they may get contaminated to waterborne diseases, and these waterborne diseases are somewhere injurious to human life. And to overcome this waterborne diseases issue, we are proposing our solution, that is Safe Pulse. Okay, so our solution is a combination of software as well as hardware. And now in the hardware, we will be implementing IoT devices, and in the software, we are planning to implement an app which will be next scalable to a website. Now in the app, we will be having a different login based role system. Now, in what do I mean by different role-based login system is that we will be having different roles such as higher authority registration, where there will be district collector, there will be district collector's associates, there will be taluka heads, and there will be at the end the ground workers. The ground workers will play a crucial role in this solution. Now, what is the district collector role is there is that the district collector will be responsible for visualizing all the data that is generated on our platform, and he will be responsible to make better policy planning and suggest them to government. Now what next will be the associates of the district collector. The associates will be registered or enrolled by the district collector himself, and these associates will be responsible for visualizing the data from the taluka heads and the ground workers. Now these associates will also have a task to register different taluka heads, as a district is formed by multiple villages coming up together and forming a district. And these multiple villages are often considered as one taluka also. So now what these associates will do is that they will also register the taluka heads, and these taluka heads will play a crucial role. These taluka heads will have the ability to assign a task to a ground worker, and they can enroll a new ground worker for any village or any area. So what these taluka heads will be doing while assigning a task is that they will assign a task like go to a village and get a weekly report about a manual report as well as IoT device report. In the manual report, what these ground workers are expected is to collect the data that is being collected during the time of census, like survey data, in which he will collect how many people are affected due to this water contamination, and how many people are showing the symptoms of these waterborne diseases. And here also a point to take away is that we will be conducting this type of task every 7 days, and by conducting this type of task every 7 days, which will enable us that there are some waterborne diseases which often show their symptoms after 7 days, and some of the exceptions are the cholera, which shows the waterborne diseases symptoms after 5 days. So 7 days is a suitable time period. After in each cycle, it will be helpful to keep the track of what is the quality of the water that these people are using in these villages. Now, what this ground worker will do, he will collect all this manual data like the count of people affected, what is their age, and things like that. And also, what he will be having is that he will be having a IoT device, and that IoT device will be responsible for collecting the quality of the water. In that IoT device, we will be mainly having the turbidity sensor, the TDS sensor, and also the pH sensor. And to know more about our sensors, you can visit the IoT setup video that is present in our drive. Okay, so now let's see what will be the next step. There will be an ML algorithm which will take all these manual survey data as well as the data collected through IoT devices, and it will run this data through our ML model, and our ML model will categorize these villages into different zones based on what is the risk level there. For example, they will be categorized into high, moderate, or low. If they are categorized into a high region, that means there are cases of waterborne diseases very high, and the water quality there is not also that good. As there is not the water quality is good over there, so there will be a notification or an alert sent to the nearby water department to clean the water source. And also one point I would like to highlight is that when these ground workers will be collecting the data and uploading it on our app, suppose if there is no connectivity, then the data will be cached locally and it will be forwarded into our database once the connection connectivity is resolved. And also to ensure that the ground worker is inserting genuine and robust data, we will all we will take his photo at every time while he is uploading the data. For example, if he is gone for a visit now, then we will collect a photo from him at that moment by his camera and capture it, and we will run it through our ML algorithm to check if he is ensuring the data now and he is not cheating anything. And also, as we talked about the classification of zones for the villages, if the village is categorized into a high danger zone, then what we will do is that we will send alert to a nearby hospital which will have the ability to schedule a camp over there. So in this feature, there comes our block section. Our block section is the section where these hospitals can announce what type of camp they are going to organize, what is the timing, and there will be an option for the villagers who are living in that village to pre-book an appointment. And also this block section will be available and seen to every role-based user, where the villagers can upload an image while about complaining something that there is the water is not clean or things like that. But also on the other hand, they can appreciate the government for taking such type of good initiatives. And this is all about our the thing that we can call is that blog section. And also we are planning to implement a chatbot which will help the villagers so that they can get quick easy access to home remedies for the symptoms that they are getting to be shown as a waterborne diseases. Okay, so this is our proposed solution. Now let's see the tech stack and all. So now for the tech stack that we have used is that we will be using Flutter to develop a mobile app. We will be implementing the backend using Node.js, and for database we will be using SQL and MongoDB, and for IoT hardware we will be using the TDS sensor, pH sensor and as well as the turbidity sensor. And for ML models, we will be using XGBoost to for predictive analysis, and for notifications, we will be using the Firebase. And one thing I would like to add is that as the people who will be categorized into different regions based on their village zone, they will be sent notification. For example, if the person is living in a high risk zone, then he will be sent a notification about how to keep themselves clean and how to have public hygiene. And if a person is living in a moderate area, then accordingly the notifications will be sent. And for low region also, the notifications will be sent like that only. But to keep in mind that not sending too much notifications, due to which the person who is using the app might not get irritated. That's why we will be sending the ample amount of notification which will not irritate them, as well as which will also be helpful to them. And for showing you the IoT setup, that is the circuit diagram, here it is. And also I would like to recommend you to visit our drive links to see the IoT setup. And now let's see the prototype. So, hello everyone, this is our prototype. Here is the registration page where the district collector, hospitals and villages can register themselves. And for district collector, they need to insert and secret key which will be provided from our end. Okay, so this is our login page. Suppose we log in using the credentials for a district collector. And okay, so just give me a second. If we log in, here there will be a manual registration for his associates where he can manually register them. And yes, this is the page where he can manually register them, or he can register. Here he will see all the posts that are being done by the users, by the villagers, and here he can edit his details. So now let's see the associate page. Let's log in using the credentials of the associates registered by the district collector. Here the associate can register different taluka heads, as a district is formed by the combination of multiple talukas, and all those talukas always have taluka head, and he can register the taluka head here in this page. And he will also have a post management page and associate dashboard which he can use to edit his details. Now let's go to taluka head dashboard. The taluka head dashboard will be consisting of showing all the taluka ground workers present in that taluka. For example, Rachel Zeen is being a ground worker in the Ambernath taluka, so she is visible here. And here he can click to assign a task like to collect water quality details using IoT device and manual survey, things like that. And he can see those tasks here only based on their taluka filter. And here he can also see a post management section where he will see all the blogs that are being done by hospitals or by villages. Now let's log in using a credentials of a ground worker. This is a ground worker where he will be shown all the tasks that he has been assigned, and his recent assessment. And here will be a new assessment where the task that he is being assigned, for which he have to fill these details. And these turbidity, pH level and TDS level will be calculated using the IoT data. So that's why here is the option for IoT data, and this data will be cached locally when there is no internet connectivity. And we will get the internet connectivity once it reaches internet connected zone. And here, for just simplification, we have designed this map in our web based platform. It will be surely integrated into our app, but for development journey we have used it by showing the map like this, where all the villages inside a taluka are being highlighted with different zones. And here are the villages with unsafe water quality, as this unsafe water quality will also be calculated by ML model of ours. And this is a type of prototype which we have designed which will also can be integrated into our app. For example, if we scale up this platform to central government level, where the central government authorities can also see which state, which district, and which sub district, and also which village is being affected with what which falls under which category zone. For example, it falls under a high or a moderate or a low risk zone. Okay, so he can see that by going this, and inside going this, like this he can see all the regions and all the villages which are being affected by those things. And he can see this, this is a future scope, but we can also add this, and also this is our prototype. Thank you. So as of now, we have just seen our proposed solution as well as what is the problem and what is our prototype. Now let's see the feasibility and viability for our solution. The feasibility is that it utilizes less cost and readily available IoT sensors. The second is that we are using the mobile first approach, due to which it will make our reach to the maximum number of people. And also we are implementing a offline first architecture. That means if there is a network connectivity issue for the ground worker while uploading the data, then that data will be cached locally, and once the internet connectivity is resumed, it will be stored inside our database. Now the key challenges is that first is the adoption rate, that the people should adopt the app, and also the potential IoT sensors malfunction, like when the ground worker is taking the inputs for the quality of the water, there might be times when these sensors will show the harm reading. Although it's not a possibility, but yes, it can be a challenge to our solution. Yes, and also the ground workers honesty will also be checked, because he should not enter any fake data. So yes, and with the connectivity issue which I just told earlier. And also our mitigation strategy is that to overcome the honesty, that is the manipulation in the data by the ground worker, we are implementing a photo verification AI for ground workers to ensure authenticity. And also we will be using a fallback mechanism for our IoT data transmission, like there will be continuous readings taken for that water source, and the average of all the readings will be considered for our ML algorithm prediction. And all, yes, so this is our feasibility and viability. So now let's see the impacts and benefits of our solution. The first and major impact is that extends critical health services to remote and undeserved rural population. And the second impact will be like significantly reduces outbreak severity and spread of waterborne illness. And the tangible benefits, like social benefit is like save life and builds community trust in public health initiative. The second will be economic, where there is a decrease in healthcare expenditure through measures and early interventions. The third is that environmental, where we will promote water safety practices and encourage cleanliness. Now, also we will be having a role-based access as mentioned in the solution. These are different types of role-based access and their roles mentioned. The higher authority will be the one who will be planning different policies based on the data. The associates are the ones who are the associate of higher authority and responsible for registering the taluka head. Ground workers are the one who will collect the data after each 7 days. The hospitals will be the ones who will conduct health camps in those regions, and there will be normal users like citizens who will be the people from this villages. As of now, we have just seen our profound and impact. Let's see the research and references that we have used that has helped us to improve the solution strategy. The first is the research paper that we have used, and let's dive into what that paper slash report focused on our inspired project. The first, that is the Chaudhary ETAL, the research paper focused on ML plus spatio-temporal disease prediction, and we have and the feature that we inspired to implement in our project is ML model plus risk-based village heat maps. And also the second is Pangotra, where there was community awareness and self-reporting from which we implemented blog section and tired notification. The third was NEMA Day, from which the paper focused on IoT sensors for water quality forecasting, from which we implemented IoT sensor integration in our survey. The last is the WHO report 2023, from where the paper focused on global burden of unsafe water and sanitation, from which we implemented core motivation to reduce rural waterborne diseases. Some of the unique additions of our own is that we implemented hospital camp integration. We also implemented ground worker verification and also multilingual as well as audio psychology aware communication. Thank you. This is our proposed solution, and I hope you everyone enjoyed our presentation. Thank you.